with the agenda items, this other was just added, and it was associated with the article that was in the paper Saturday morning. So it was published online, it was in the paper Saturday morning, and I've done some investigation on it. I know a little bit more about the situation than I did Friday. But I wanted to talk about it. So I don't know if everybody here has read the article. I don't know the title of it. Does anyone recall the title of it? Something about requests for health for inspections piling up.
Which I can read it. Sure. Moline has no health inspector, and the requests for inspections are piling up according to the PC terms.
So when I read that, it was news to me. So I was unaware of that situation, and I called around to some of the aldermen, and I wasn't able to find an alderman that was aware of it either. Nita Ludwig was cited in the article for confirming it. So that was the only source that confirmed it. I even talked to Alderman Potter, and Alderman Potter didn't have any independent knowledge of there being delayed inspections, but was put in the article, and he hadn't provided the information, but Nita had confirmed it. I talked to Nita. Nita told me that she didn't confirm it. I later believe that she said something that indicated that it was true. So I think it was just some misinformation, but Nita said that she didn't confirm it, that she doesn't have that specific information, and she wasn't aware of a piling up of inspections, although they had been helping us since our vacancy had occurred. So that's kind of what I discovered about it. I've done some additional research, and I had staff pull information for me, like what we've done for inspections in the past, what triggers a request for an inspection, that kind of information. I got confirmation from JD, and JD's here. I don't know, is JD available?
He's here, yeah.
Thank you. And so he oversees the health inspectors. He's the highest up as the director of public works, and so he was able to check the information. But while we're waiting for him, he also confirmed that there was not a backlog of requests for inspection. So that's the situation. It was concerning to me because I felt like it gave the impression to the community that maybe our restaurants were being safe, or the verifying that they were safe. I do not believe that to be the case. I think that it was some misreporting of the situation. We certainly do have a vacancy, though. JD, I was just kind of speaking for you, and I thought since you were here that you had provided information as the director of the department that houses the health inspector, that you were able to verify to me that we did not have a backlog of requests for inspections. Is that correct?
That's correct, Roman.
Thank you.
And I'm not personally involved with it, but I did check with our staff, and got a couple new restaurants open since our vacancy, and I'd like those to come and help facilitate the opening through their services. The same thing with a couple plan reviews that we had to have done, and they did for us. So us like you, after Carol drew my attention to the article, I think Saturday, Carol, was that when you reached out to me? It was the first that we had heard of it as well. Joe confirmed that you had no reason to believe there was any kind of backlog.
Right, and it is. I mean, doing the health inspections is yeoman's task. I mean, there's a lot of work to be done to make sure that everything is being checked and followed up on. And Andy did a great job for us. But in the year of COVID, it certainly has been different. So like I guess I didn't add these up, but generally the last 3 months that Andy was here for the full month, he did 11 inspections, the dates that I had, the documentations that I got. He did 11 1 month, 8 1 month, and 2 1 month. The previous year, there had been 45, 34, and 25, and those are the months of May, June, July. So I think that COVID significantly impacted that work anyway. But I just wanted to assure the public that our restaurants are safe, our restaurants are well run. We have good documentation of that, and to reassure them that, sometimes things are printed and may give an indication that isn't accurate. So if the community ever has any questions or concerns, please reach out to, either your elected officials or our professional staff, and we will try to make sure that we get you all the information that you need. Does anybody have anything else they want to add? So we're,
Could I have one more thing? We have also been the intake for, when people have concerns about maybe restaurants where folks aren't following the mask guidance. And we're actually taking care of these in-house by the first contact is going out and giving them the reminders. I think that's constantly over time. And then we pass it on if there's any.
yeah, that's perfect. So Davey's just referring to our role in the enforcement of government's order, that our first step is education, our second step is providing notices, and we're doing that in-house. And then we share the notices that we issue with the county that has more enforcement authority than what we have. Alderman Potter, did you have something on that?
I guess my concern is that, given the number of inspections that we did, pre-COVID, I know the history here and that, we previously relied on the county for inspections and they weren't being done at the, level that the previous council preferred them to be at, given the fact that we have, an enormous amount of restaurants and other food serving industries in town, and that was the concern that, at some point in time, I think we're gonna need to back up our position to ensure that public safety continues to be covered.
I think that is a very good argument. When, the way that it works is it's really the health department's responsibility for the inspections, but somewhere along the timeline, the city of Moline, the city of Rock Island, and the city of East Moline all took that responsibility in-house. One of the main advantages from my perspective of keeping it in-house is that we actually charge lower fees than what the county charges. So as soon as you put that responsibility back on the county, it actually impacts our restaurants because it'll cost them a little bit more. It's not a lot, but it's significant when you're running a restaurant. So there's reasons to do it. I know that I was in one meeting and Marty has been in another, and I think there's a meeting coming up to better complement each other, because we each have one inspector typically on staff and they go on vacations and they get sick. And so we cross cover, and we have problems with consistency in that. And so the municipalities are talking to each other to figure out, what's the best way to provide that service across our municipalities, and how do we do that in the best way that provides the safety we're looking for our community, as well as consistency for our business owners. So I know all of that is in the mix, and it's something we're going to talk about later with WHR's specific recommendations. So we'll have an opportunity to really debate that specific inspector role and how we want it to be handled moving forward. So that's on our agenda. So moving ahead past that, there was another component of that article that was